The Nigeria Center for Disease Control in its latest report has confirmed at least 195 cases and 29 deaths from the recent Lassa fever outbreak in 11 states of the country. Briefing newsmen on efforts by the federal government to combat the epidemic, the Minister of Environment, Muhammad Abubakar, says out of the confirmed cases, 89% are from Ondo, Edo and Ebonyi states. The report. The Lassa fever virus is transmitted by rodents, which can be found in homes, motor parks, offices, and even places of worship. Lassa fever is an acute viral hemorrhagic illness. It is transmitted to humans through contact with food or household items contaminated with rats' urine or feces. Giving an update on the current outbreak of the epidemic, the Minister of Environment, Muhammad Abubakar, said 11 out of the 36 states of the Federation are affected and that concerted efforts are in progress to contain the epidemic.
195 confirmed cases and 29 deaths have been recorded in 11 states of the Federation, namely Edo, Ondo, Ebonyi, Delta, Taraba, Plateau, Bauchi, Ogun, Abia, Kano, and Enugu. Out of the confirmed cases, 89% are from Ondo, Edo, and Ebonyi states. Before the recent outbreak, the ministry has taken preventive, proactive measures to improve the overall general sanitation and hygiene situation in the country. The ministry in 2019 established sanitation desks in all 36 states of the Federation, and these sanitation officers are to coordinate sanitation and related activities within their states, liaise with their respective local government environment departments, and report back to the Ministry of Environment. They are also expected to monitor and report Lassa fever cases and other environmental determinants of diseases to the Federal Ministry of Environment, headquarters in Mabushi. The sanitation desks are to be replicated in all the 774 local governments in the country.
The minister, who says the sensitization campaign is being stepped up, appealed to the general public to help in the prevention and control the disease.
The Federal Ministry of Environment has directed all environmental health professionals in the Federation, at the federal level, state and local government, to immediately re-embark on the following. 1. Massive awareness campaign on the need to keep the environment clean. 2. Environmental health surveillance of premises to identify rodent harborage, destroy, eradicate rodent homes, commercial and industrial premises. Effective pest and vector control services in residential and commercial premises, notably deratization of marketplaces and homes. Development of sanitary means and facilities for drying of food, cereals, legumes, and tuber to ward off the invasion of rodents. This strategy shall be deployed, and the Environmental Health Council of Nigeria is there to monitor compliance and report back to the ministry.
Lassa fever remains a perennial challenge in some parts of Nigeria. How the authorities will deal with the current outbreak from spreading to other states of the Federation and the Federal Capital Territory, FCT, is another litmus test. Rose Audu, reporting for Clearview Television.